The idea behind this is that the body has a hydraulic system, whereas every cell in our body is wet, and that moisture that does that is intertwined with the lymphatic and interstitial fluid and the blood vessels and all that, and that it is constantly being moved, replenished, refreshed, and recycled. And that my sense is when there is congestion in an area, we get swelling, which puts pressure on the cells around that area, swells up like a balloon. It becomes tender because of that pressure. And oftentimes that pressure can be relieved, that congestion can be reduced through using a Berry method of manual lymphatic drainage. It's been around for centuries and it continues to help people. And we named it that because we didn't know what else to call it. And here's the concept, is that fluid is constantly moving. And when it gets congested, we start to have problems. Over a long period of time, my sense is that congestion can become more of an infectious congestion that probably isn't good for us. I've seen this technique work. Now I want to share it with you. Okay, breast drain 101. Underneath the breast, against the thoracic cavity, is what I call the transition point. Straight back from the nipple, in between the ribs, there's a little dip there. That's where the primary fluid from the breast continues its ongoing, shall we say, flow into the thoracic cavity, down into the abdomen, where it gets recycled, replenished, and refreshed. Oftentimes, what appears to happen is that transition point gets congested, gets plugged, so that the fluid backs up and sits there longer than it's supposed to. It can be considered similar to what a drain in a sink looks like. It gets plugged with food particles. You got to go in and clean them out and get it to rinse through so that the fluid can continue to drain through there. So here's the technique. Here's actually two techniques to get that drain open. One is to go under, lift up the breast, go under and find that dent. And there's an absolute dent there. Trust me, just a little concavity, if you will. You find it and then work around the edges, much like you were trying to open it up, just to scooch, if you will, the particles are away from the center so that can open up and drain. Second technique, and it'll probably be a little sore, so be gentle with yourself. Second approach is to push directly on the nipple. Gently, this is going to be tender. You'll feel it, that little concavity, that is going to start pushing fluid down towards that drain. So you put that pressure, and then again that little circular movement away from the center to try and open it up. Over time, this will become less tender. Over time, this will, shall we say, help reduce the pressure that contributes to the sensitivity. It should become less sensitive. Guys, you can do this too. Okay, now the other part to this is once you've opened up that drain, you want to encourage the fluid to move through. Basically, there's a nipple, you come, cup it, and then a gentle squeeze, like you're trying to encourage the fluid to go towards that drain. Just hold it for a few seconds and relax. That's all there is to this particular portion, this particular component. What's necessary, what's advantageous, is if you can find a therapist who is trained in the Berry method of manual lymphatic drainage. There are a number in Oregon, there are a number in California, there's some in Virginia, there are some apprentices spread throughout the land, and most of them will tell you whether they have mastered this technique, whether they are trained in it, whether they can help you continue draining the upper body and getting the fluids moving. It's a useful technique. Again, this wasn't the most comfortable thing for me to do, but I think it was very important. I hope it serves you. Happy trails.